The very real threat of coronavirus. The first British victim, a Diamond Princess cruise passenger, was announced at the same time as 3 new cases in the UK. 2 patients in England who had recently returned from Iran, and the first recorded case in Wales, a traveller back from northern Italy.
We are expecting to see more cases. There's very little doubt now that we will see that. That's happening in other parts of the world. Our challenge now is to get the NHS ready, prepared to be able to deal with the consequences of that.
Frontline critical care doctors, those who treat the sickest patients, say they're not ready. They say the NHS is already at breaking point and a surge in COVID-19 cases would cripple the health service.
My main concern is going forward, are we going to be able to accommodate an influx of patients should tomorrow the situation get worse? So we already know that we're at capacity and a lot of units are saying that we're cancelling patients anyway. Add on top of that new patients that are coming in, we'll find that we're in a position where we're not able to accommodate them.
There are currently just over 4,000 critical care beds available in England. To allow for a rise in demand, a critical care unit should be no more than 85% full. In December, they were just over 75% full, which is okay. But looking under the surface of that figure reveals a different picture. A quarter of trusts in England had 85% or more of their beds in use, and 11 NHS trusts had every single bed in use. The winter pressures mean some elective operations have already been cancelled. But if there's a large outbreak of coronavirus, more difficult choices will have to be made.
What people will be working very hard at now is trying to make sure that no urgent treatments, cancer treatments, for example, get delayed. But of course, there are going to be knock-on consequences.
The Department of Health and Social Care told us they expect the virus to have some impact on the UK and are planning for any eventuality. Doctors make life and death choices all the time, but if COVID-19 spreads in this country, they may be forced to make those decisions more frequently. Ashish Joshi, Sky News.